Well, despite the Bay Area's relatively high vaccination rates, nearly 2 million people, tens of thousands in each county, have yet to roll up their sleeves.
On the road to recovery, Alan Martin has a story of one newly vaccinated COVID survivor from San Mateo County who is using his second chance to try to save others.
He's really very lucky guy, Ken. Elizabeth. A recent survey actually found that most unvaccinated adults do not believe that the COVID shot works and that it poses a greater risk to their health than the actual virus. That's why this 38-year-old father wants everyone to know his story. These days in the Bay Area, it is common to see healthcare workers prepare a COVID vaccine.
You can sit on the table. We'll do you first, Dad.
But for this nurse practitioner, nothing could prepare her for her next two patients.
I feel like I'm going to cry thinking about it, but hearing these stories it's heartfelt, you know?
At a Sutter clinic in San Francisco, Jose Jimenez and his 12-year-old daughter, Sadie, are about to get their first COVID shots.
I'm very happy that I'm finally getting it.
I'm very lucky to be here.
Lucky because Jose almost died and Sadie almost lost her dad.
It was very touch and go for him for a while.
Here's what happened. When the COVID vaccines rolled out, Jose was skeptical, not knowing who or what to believe.
Joe Rogan in one ear, and I have conspiracy theorists in the other, doctors and professionals on TV.
The bar manager decided not to get vaccinated. He thought if he got sick, he'd just fight it off.
Take my vitamins, my supplements, trying to lose weight.
Jose is not the only one. According to a recent survey, 3 in 10 American adults remain unvaccinated. While the reasons are varied and complex, one thing is clear.
We've seen our ICUs fill up.
Dr. Thomas Shaughnessy is a critical care specialist at Sutter's Mills Peninsula Medical Center. He was on the team that took care of Jose. With the Delta variant, doctors now see much younger unvaccinated patients end up on ventilators.
The lungs basically aren't doing their jobs anymore.
Healthy lungs look like this. Here are the lungs of a COVID patient, much like Jose's. The infection inflames the lungs. They fill up with a dense fluid, making it impossible to deliver oxygen to the body or to remove carbon dioxide.
With this much water filling the lungs, the patient is literally drowning.
I had an odd headache.
Jose went to a clinic where he tested positive for COVID. He ended up in the emergency room at Mills Peninsula.
But he rapidly deteriorated to developing respiratory failure.
The 38-year-old was rushed to the ICU and put on a ventilator. His family was shocked, worried, and scared.
When, why, how?
The next thing Jose remembers?
Waking up in the hospital almost a month later.
His first thought?
Where am I and what's happening?
His second thought? Sadie.
Where is she? And is she okay? You know, it's the one thing I live for every day.
According to the CDC, people like Jose with a prior COVID infection still need to get vaccinated. There's evidence it provides a stronger level of protection. You can get COVID more than once.
We can't change the past for Jose, but potentially, hopefully, we can change the future.
All right, ready?
Yeah.
Jose got vaccinated first. Then he held Sadie's hand as she got hers.
A really miraculous story.
As they left the clinic, the father and daughter headed out for something you may take for granted, grabbing a bite to eat.
To everyone out there, my one message is take that leap of faith, be aware of what you're doing, and get the vaccine.
Now, of course, not everyone is as lucky as Jose. As of today, just over 6,400 Bay Area residents have died of COVID-19. Elizabeth?